What do you do if your front tooth breaks? So today we're going to go through a case where we had a patient who had historically had trauma on his front tooth. Apparently him and his brother were wrestling and his front tooth got knocked pretty hard. Well, when he was younger, he ended up having to get root canals and crowns. So again, this patient was approaching his 30s, mid 30s actually on this case, and there was a lot of problems occurring from that old root canal structure. What we see in this case is actually a very rare situation of internal and external resorption. Basically, the body had rejected the tooth at this stage, and so it's eating away its own. It's an autoimmune attack on its own tooth. As you can see here on this image, again, the root canal is completely shot. The bones quite compromised. There is infection of the existing root canal structure. In this photo as well, you can see that the tooth has avulsed in that sense that it's hanging low. So again, when this patient presented, the tooth was actually moving and it was sitting casually about 4 millimeters below any of the other teeth. Again, we always start with good planning. We did work with a periodontist on this case to really build up the bone volume because it was such a massive defect. Once we laid the foundation of getting good, strong bone, that's when we were comfortable to go ahead with the implant therapy on this case. So again, just like we always do, as much as we can, guided implants are the preferred method, especially on anterior cases. Really not non-negotiable for us at Onyx Dental. So again, we placed the implant, we placed a custom healer. We've gone ahead and placed an immediate provisional for this patient, just because he didn't want to be missing his front tooth for 4 months. Yeah, and so that's more or less it with that one. But again, just be cautious with regards to childhood injuries and what that can lead to long term for our patients. You know, these things really catch up with our patients if they've had a trauma, and traumas are quite common, believe it or not. It's a lot of the cases that we end up correcting 30 years down the road. But with good planning and good communication, we can really help our patients.